When performing hand hygiene, how long should a nurse wash their hands with a soap and water? At least 10 seconds, at least 15 seconds, at least 20 seconds, at least 5 seconds. The correct answer is option C, at least 20 seconds. How often should vital sign be checked for a stable post-operative patient? Every 2 hours, every 4 hours, every 6 hours, once a day. The correct answer is option B, every 4 hours. Which nursing intervention is essential for a bedridden patient to prevent pressure ulcers? Apply lotion daily, turn the patient every 2 hours, keep the patient covered with blankets, limit fluid intake. The correct answer is option B, turn the patient every 2 hours. Which position is used to reduce the risk of aspiration during tube feeding? Frown, supine, semi-Fowler's, Trendelenburg. The correct answer is option C, semi-Fowler's. Subcutaneous injection is also known as intradermal injection, hypodermal injection, intramuscular injection, intravenous injection. The correct answer is option B, hypodermal injection. When applying ice to an injury, how long should it typically remain in place? 5 minutes, 10 minutes, 15 to 20 minutes, 30 minutes. The correct answer is option C, 15 to 20 minutes. Which of the following is a sign of hypoxia? Red cheeks, elevated blood pressure, cyanosis, warm flushed skin. The correct answer is option C, cyanosis. During CPR, proper hand placement is essential to prevent the risk of which complication? Rib fractures, cardiac arrhythmias, pulmonary embolism, hyperventilation. The correct answer is option A, rib fractures. In which position should a patient be placed to prevent aspiration while eating? Supine, Frown, Fowler's, Trendelenburg. The correct answer is option C, Fowler's. A patient reports feeling dizzy when moving from lying down to standing. This is known as orthostatic hypotension, hypertension, hyperglycemia, hypovolemia. The correct answer is option A, orthostatic hypotension. Which vital sign measurement can give early clues about infection? Blood pressure, temperature, oxygen saturation, heart rate. The correct answer is option B, temperature. What is the best way to confirm the identity of a patient? Ask them their name, check their ID bracelet, ask a family member, read their medical chart. The correct answer is option B, check their ID bracelet. While positioning a patient in the Fowler position, the head of the bed is elevated to an angle of 30 to 45 degrees, 45 to 60 degrees, 60 to 90 degrees, 0 to 15 degrees. The correct answer is option B, 45 to 60 degrees. The most accurate oxygen delivery system is nasal cannula, simple face mask, Venturi mask, non-rebreather mask. The correct answer is option C, Venturi mask. Which symptom indicates fluid overload in a patient receiving IV fluids? Decreased heart rate, clear lung sounds, jugular vein distension, dry mucous membranes. The correct answer is option C, jugular vein distension. In which situation should a nurse wear sterile gloves? Changing bed linens, assisting a patient with meals, inserting a urinary catheter, measuring a patient's blood pressure. The correct answer is option C, inserting a urinary catheter. Which method is most commonly used to assess lung sounds? Percussion, palpation, auscultation, observation. The correct answer is option C, auscultation. Which precaution is necessary for a patient on airborne isolation? Wear gloves only, use a surgical mask, use an N95 respirator mask, use a face shield. The correct answer is option C, use an N95 respirator mask. Which position is commonly used to examine the abdomen? Supine, Frohn, Fowler's, Trendelenburg. The correct answer is option A, supine. A patient's blood pressure should be measured in which arm position? Above heart level, at heart level, below heart level, at any level. The correct answer is option B, at heart level. Which symptom would alert the nurse to a possible blood transfusion reaction? Fever and chills, decreased heart rate, increased urine output, drowsiness. The correct answer is option A, fever and chills. What does SOF in medical documentation stand for? Symptoms Observation Analysis Plan, Subjective Objective Assessment Plan, Sign Order Analysis Procedure, Standard Objective Assessment Practice. The correct answer is option B, Subjective Objective Assessment Plan. Which route of medication administration has the fastest absorption rate? Oral, intravenous, subcutaneous, intradermal. The correct answer is option B, intravenous. What is the best way to assess a patient's pain level? Observe for non-verbal cues, use a pain scale, ask the family members, document as mild, moderate or severe. The correct answer is option B, use a pain scale. Which infection control measure is most effective for preventing the spread of pathogens? Wearing gloves, using hand sanitizer, hand washing with soap and water, disinfecting equipment. The correct answer is option C, hand washing with soap and water. Which term describes abnormally high blood pressure? Hypotension, hypertension, hypoxia, hyperglycemia. The correct answer is option B, hypertension. A blood pressure reading of 120/80 mmHg is considered low, normal, high, critical. The correct answer is option B, normal.